Hello, good day. I'm Blanche Irish B. Panias, a Level 3 student nurse from Visayas State University, and today I'll be talking about vulvar cancer. So for today's topic, I'll be talking about its definition, etiology, pathophysiology, signs and symptoms, complication, diagnostic and lab procedures, management, nursing diagnosis, nursing interventions, and its prognosis. So what is vulvar cancer? So by definition, vulvar cancer is the cancer of the vulva. It's the most commonly carcinoma of the labia majora, labia minora, or clitoris. It may also originate as a urethral tumor. It is the fourth most common gynecologic cancer. Vulvar cancer is a type of cancer that occurs on the outer surface area of a female genital. The vulva is the area of skin that surrounds the urethra and vagina, including the clitoris and labia. Vulvar cancer commonly forms as a lump or sore on the vulva that often causes itching. Though it can occur at any age, vulvar cancer is most commonly diagnosed in older adults. There are 5 types of vulvar cancer. First is squamous cell carcinoma. Second, vulvar melanoma. Third, adenocarcinoma. Fourth, sarcoma. And fifth is verrucous carcinoma. So the first type, the squamous cell carcinoma, it affects the flat outer layer of skin. In medicine, the word squamous refers to flat cells that look like fish scales. About 90% of all vulvar cancer are squamous cell carcinomas. It takes several years for noticeable symptoms to develop. So the next type is vulvar melanoma. It accounts for 5% of all vulvar cancer. A melanoma present as a dark patch of discoloration. There is a high risk of this type of cancer spreading to other parts of the body, a process known as metastasis. It may affect younger women. The next type is adenocarcinoma. It originates in glandular tissue, and in this case, the cell line the glands in the vulva. It accounts for a very small proportion of vulvar cancer. The next type is sarcoma. It originates in the connective tissue. Most cancer of this type are malignant, and it is rare. And the last type is the verrucous carcinoma. It's a subtype of a squamous cell cancer, and it is tend to appear as a slowly growing wart. Now going on its etiology, studies suggest that squamous cell cancer of the vulva can develop in at least 2 ways. In up to half of cases, HPV infection appears to have an important role. Vulvar cancer associated with HPV infection, the basaloid and warty subtype, seem to have certain distinctive features. They're often found along with several other areas of vulvar intraepithelial neoplasia or VIN. So the second process by which vulvar cancer develops does not involve HPV infection. Vulvar cancer not linked to HPV infection are usually diagnosed in older women over age 55. This woman may have light chain sclerosis and may also have the differentiated type of VIN. DNA tests from vulvar cancer in older women rarely show HPV infection, but often shows mutation of the p53 tumor suppressor gene. The p53 gene is important to prevent cells from becoming cancerous. When this gene has undergone mutation, it is easier for cancer to develop. Cancer happens when cell growth is out of control. Most cancer harm the body when damaged cells divide uncontrollably to form lumps or masses of tissue or tumors. Tumors can grow and affect body function. A benign tumor stays in one place and does not spread, but a malignant tumor spread and cause further damage. Now going on to the pathophysiology. First, it forms when there are errors in normal endometrial cell growth. Then, it starts when cells from unneeded and old or damaged cells do not die as they should. These abnormal cancer cells have many genetic abnormalities that cause them to grow excessively. And lastly, mutations are found in a tumor suppressor gene, commonly p53, or overexpression of PI3K or AKT kinase pathway, which promotes cell growth in the cancer. Malignancy occurs when two things happen. First, a cancerous cell manages to move throughout the body using the blood or lymph systems, destroying healthy tissue via a process called invasion. Then second, the cell divides and grows through a process called angiogenesis, making new blood vessels to feed itself. Without treatment, cancer can grow and spread to other parts of the body. This is called metastasis. If it enters the lymphatic system, it can reach the other parts of the body, including the vital organs. For the risk factors, it includes the following: smoking, HPV, women aged older than 50 years old, immune system deficiency, precancerous condition, light chain sclerosis. This condition affects the vulvar skin. Now let's go on to the signs and symptoms of vulvar cancer. The first sign is usually a lump or ulceration, possibly with itching, irritation, or bleeding. Sometimes a woman may not seek medical help at once due to embarrassment, but an early diagnosis will improve the outlook. Most typical symptoms include painful sexual intercourse, bleeding, pain and burning, dark discoloration in cases of melanoma, painful urination, persistent itching, rawness and sensitivity, wart-like growths, thickened skin, and ulceration. Complications are broken up into acute and chronic categories. Some of the commonly associated problems from radical vulvar surgery include acute issues such as wound complication, thrombosis, UTI, incontinence, seroma, hematoma, phlebitis, and osteitis. Chronic complications such as lymphedema, lymphocyl, vaginal stenosis, dyspareunia, pelvic relaxation, abnormal micturition, and incontinence. Complications from vulvar cancer are rare. If the disease progresses, complication includes lymphedema, cellulitis, bone metastasis, and urethral obstruction. Now let's proceed to the diagnostic and lab procedure for vulvar cancer. A medical history. Your doctor will ask about your overall health, including habits and illnesses. A pelvic exam. They'll check your vulva for sign of cancer by looking at the area and feeling your uterus, vagina, ovaries, bladder, and rectum. Colposcopy, a magnifying tool called a coloscope, can give a close-up look at any problem areas in your vagina, vulva, and cervix. This procedure is also called a vulvoscopy. Biopsy, your doctor might take a bit of a tissue for a specialist to look at under a microscope. And the last procedure is imaging tests. X-ray, CT, and PET scan and MRIs make detailed picture of the inside of your body to tell your doctor if you have cancer or how far it is spread. Now let's go on to the stages of vulvar cancer. If tests show signs of cancer, your doctor will look at how big the tumor is and whether it is spread. This is called staging. There are 4 stages for vulvar cancer. So the first stage, the tumor is small and hasn't spread past your vulva and perineum. Stage 2, the cancer has moved into nearby tissue but not your lymph nodes. Stage 3, it is spread to nearby tissue and to the lymph nodes in your groin. And lastly, stage 4, cancer has reached the upper part of your vagina, urethra, or anus, or a part of your body that is further away. Now let's proceed to the management for vulvar cancer. So surgery, this is the most common. Your doctor might use one of these procedures: ultrasound surgical aspiration, laser surgery, and excision. Ultrasound surgical aspiration, sound waves break up the tumor into small pieces and your doctor takes them out. For laser surgery, they use a laser to cut into or take out affected tissue such as your lymph nodes, parts of your vulva, or other organs. This treatment is not used for invasive tumor. And lastly, excision. Your doctor takes out the tumor and tissue around it. A wide local excision removes from the tissue. A radical local excision takes out a large amount of tissue and possibly lymph nodes. We also have vulvectomy, where part of your vulva is removed, and there are 4 types of vulvectomy. The first type is the skinning vulvectomy. Your doctor takes the top layer of your skin of your vulva. The second type is the simple vulvectomy. This procedure removes your entire vulva and tissue just under the skin. The third type is the partial or modified radical vulvectomy. This involves removing most of your vulva and possibly nearby lymph nodes. And the last type is the radical vulvectomy. Your doctor removes the entire vulva and nearby lymph nodes. We also have pelvic exenteration. This procedure removes your vulva and lymph nodes, as well as one or more of the nearby organs, such as lower colon, rectum, bladder, uterus, cervix, or vagina. Radiation therapy. This uses high-powered X-ray or other form of radiation to kill cancer. Your doctor might use a machine that beams the ray into your body, or implant a radioactive needle or seed inside your body or near the cancer. For chemotherapy or chemo, this uses medicine to kill or stop the growth of cancer cells. You can take this drug by mouth or through an IV. Some kind comes as lotion or cream that you can put on your skin. So the last management is biological therapy or immunotherapy. This targets your immune system to boost your body's defense against cancer. So these are the possible nursing diagnoses: risk for fluid volume deficit, risk for infection, risk for altered family process, readiness for enhanced self-care, pain, anxiety, knowledge deficit, body image disturbance, fear, impaired skin or tissue integrity, impaired elimination pattern, self-care deficit, alteration in nutrition less than body requirements, disturbed sleeping pattern, situational low self-esteem, and anticipatory grieving. Listed also in here is the possible nursing interventions. Assess patient thoroughly for any possible entry point or signs and symptoms of infection regularly, such as checking its skin integrity, respiratory system, and detubing. Assess the skin turgor of the patient, taking care to obtain findings in area not easily affected by weight loss or weight gain, such as the chest wall. Identify other parameters such as hematocrit counts, urine specific gravity, and other indicators of fluid balance. Observe usual family dynamics between the patient, his family, and the significant others. Determine the roles that each one plays and how it relates to other members. And lastly, allow patient to verbalize their pain and acknowledge it. Now let's go on to the prognosis of vulvar cancer. The 5-year survival rate for women with vulvar cancer is 71%. However, survival rates depend on the several factors, including the type of vulvar cancer and the stage of the disease at the time it is diagnosed. The 5-year survival rate for cancer that has not spread beyond the vulva is 86%. So now we have come to an end. I hope you learned something for today's topic. Thank you for watching. This is Blanche Ibanez, your student nurse from Visayas State University.